Good morning, good afternoon, good evening, wherever you are around the world. Welcome to today's Postgrad webinar. Something new and something different today that we've not really heard about much from the postgrad world, and that's an MSc in clinical exercise physiology from the University of Southampton, who are a global top 100 university, one of the founding members of the Russell Group, top university in the UK, and we're very excited to hear from them about this course specifically. Now, if you are watching on demand, it is the 18th of March as we're filming this live. You do need to send your questions through to the relevant team depending on what's in the presentation. If not, we'll send you some links to get in touch directly with Southampton. And if you are watching live today, please pop your questions in the Q&A chat or the chat facility. Say hi, where you're from. Be really nice to see so many different voices and faces from around the world. But for now, thank you very much. I'll hand you over to Danielle. Danielle will take you through the next 30, 40 minutes. I'll be back for the Q&A at the end. Over to you, Danielle.
Thank you. Hello and welcome to this webinar. I'm going to be giving you an overview of our brand new MSc in Clinical Exercise Physiology at the University of Southampton. And before we get started, I'd just like to personally thank you all for your time today and for coming to listening to us or listening to us on demand if you're catching up. And as Gareth said, there'll be plenty of time for some questions at the end. So if you have those, save them up and I'll be very happy to address those. Okay, so the agenda for today's meeting, I'm going to start by giving you a bit of an overview of our core programme team. So I think it's important that you get to know us a little bit in terms of who will be delivering this programme at Southampton. And I'm going to provide a bit of high-level information on each of our staff, but all of our core team that deliver into this programme, we're all active researchers and educators. So if you want to find out a little bit more about us, then a quick search online is going to provide a lot more detail about the role of each of us in terms of our research areas, roles and responsibilities outside of this programme. So I'm then going to give a bit of an overview of clinical exercise physiology as a profession and how it's really kind of developed in the UK in the last sort of few years. And I'm going to talk to you a little bit about the clinical exercise physiologist scope of practice and the route way to professional accreditation. I'm going to talk a little bit about prehabilitation, just to give you a bit of an example area in which a qualified clinical exercise physiologist could work. So it's not the kind of the only area, but it's just a bit of an example as to see where we kind of operate really. Excuse me. Then I'm going to go through a bit of an overview of the programme structure at Southampton. So this will be going into a bit more detail around the modules and the clinical practice that forms part of the actual programme structure. And then I'm just going to finish off with a couple of reasons why, I know I'm a bit biased, but why Southampton is a brilliant place and why it might be a good destination for your choice of study. So as I said, then we'll finish off with some Q&A. So please do ask me anything at the end if I haven't covered it. Okay, so let's get started with our programme team. So we're not just made up of exercise scientists, we actually have hospital consultants, clinical scientists, physiologists, psychologists, podiatrists, among others. So there's a whole range of people from various different professional backgrounds that teach into the programme here at Southampton. And this intentionally reflects the real world multidisciplinary team that you'll join upon graduation. So it's by design, absolutely, and it gives a really great insight to lots of different professions in that multidisciplinary team. So this is me. I'm an associate professor in clinical exercise physiology within the School of Health Sciences, and that's in the Faculty of Environmental and Life Sciences at the University of Southampton, and I'm programme lead for the MSc. Now, my background is in sport and exercise science, and I was previously accredited as an exercise physiologist with what used to be called the BASES Association of Sport and Exercise Science, and a clinical scientist. And I'm now a registered clinical exercise physiologist with the Academy of the Healthcare Sciences. That gets abbreviated to the AHCS, and you'll see that through the presentation. And the AHCS is our UK registering body that holds the professional standards for all clinical exercise physiologists who work both within the NHS but also within community. So you'll hear me refer to this, and I will talk a little bit about that kind of accreditation pathway because it is important for working within the NHS and within the UK. So I'm also a theme lead for the get my words right, physical activity and cardiometabolic health research group. So as well as being involved in education, I'm an active researcher, and my research focuses on primary and secondary prevention of chronic diseases across the lifespan. So what that means is I'm really interested in the whole person. I look at how cardiovascular physiology and psychology interact and how we can use exercise to prevent and manage chronic conditions. So I'm particularly interested in how we support people across the entire life, from children right through to older adults, and I try and embed that within this programme. I'm also going to be the module lead for our evidence-based exercise prescription and intervention design module. So when we talk about the programme structure, you'll be able to see that. Next, we've got Professor Sandy Jack, who's Professor of Prehabilitation Medicine within the Faculty of Medicine at the University of Southampton. And Sandy is also an honorary consultant clinician scientist at University Hospital NHS Foundation Trust, which is our local NHS trust here in Southampton. Importantly, Sandy's been co-creating this programme with me from the start, which makes this a true cross-faculty collaboration in research-led education. So I'm really pleased to be able to say that we have Sandy on the call with us. So Sandy, I'll just hand over to you briefly if you'd like to have a few words on yourself.
Thank you, Danny. Yes, welcome everybody. It's a very exciting opportunity. I've just been reading the chat yes, lots of people from far and wide. As Danny said, this is our passion. I've been in this field for a pretty long time now, about 20 years experience in looking at patient outcomes with prehabilitation and also experimental medicine, looking at mechanisms. So we're hoping to bring the breadth of everything that we do in our research, but that we have a NHS funded clinical prehabilitation medicine service. Danny will go into more detail, but we are envisaging, or we are going to do our placements and practice sessions very much focused on our clinical service. So giving you the real world experience of an NHS working hospital. We're called a tertiary referral centre, so we've got lots of people from outside of our region, hence why most of our interventions for exercise in the service are delivered by our community gyms, and that's where your placements will be. Thank you very much.
Thanks, Sandy. And Sandy is going to stick around for this, so she'll be also available for answering any questions at the end. And I will pick up also on the prehab service that Sandy mentioned there as well. So next up, we've got Dr. Zoe Sainer, and Zoe is an associate professor in the School of Health Sciences. She's a registered clinical exercise physiologist as well, and she specialises in respiratory health with a particular focus on cystic fibrosis. Now, as an ex-England international rugby player, Zoe's also got a big interest in women's health and promoting women's involvement in sport. So that's another area that she's particularly keen on in her research and kind of enterprise role. So Zoe's going to be our module lead for our clinical exercise testing and interpretation module. We have Dr. Chloe Grimmett, who is also an associate professor in health sciences, and Chloe's background is in sport and exercise science, and she specialises in psychology and behaviour change. So Chloe works really closely with Sandy on a number of large clinical research trials, and these trials are ones that underpin the development of that prehabilitation medicine service that we mentioned. And Chloe is going to be our module lead for the behaviour change and adherence module. Then we have Ralph. So Ralph Gordon is a lecturer in health sciences. His background is in sport and exercise and in exercise physiology. And he specialises in thermoregulation and heat stress in different populations. So obviously very topical when we consider climate change and the effects that sort of heat stress is having on different populations. And as a result, Ralph sits within one of our research groups, the Thermolab Sense Research Group. I think I've got the right name there. Ralph's going to be our module lead for our clinical exercise delivery and evaluation module. So he's got lots of experience in the actual delivery side of exercise interventions. We have Keith McCormack, who is a senior teaching fellow in the School of Health Sciences. And Keith's background is actually as a podiatrist, but he very much specialises in diabetes management and in the pathophysiology, of a number of long-term conditions. And Keith always has also has a particular interest in simulation training within education. So he's really experienced in being able to support clinical delivery when students are on placement, and kind of building students up with some of that simulation training to support that transition from theory in university setting out into that clinical placement. So a brilliant person to have involved in the programme. And Keith is going to be our university placement lead. So he's going to support all of the placement opportunities for our students to go out and spend time with different providers. And he's also the module lead for our advanced pathophysiology and therapeutic interventions module. Then we have Dr. James Faulkner, who is an associate professor in the School of Primary Care, Population Sciences and Medical Education, and that's within the Faculty of Medicine at the University of Southampton. James is a registered CP with the AHCS, and he specialises in secondary prevention for stroke and transient ischemic attack. So James is a really great contribution to our programme. He's internationally recognised for his work and is one of few CEPs working in the UK specialising in this particular area. So he's a real asset. Moving to a slightly different vein, one of the key elements of our programme, which I'll discuss further in a minute, is actually the really close relationship with our service, our clinical service operating at UHS, our local hospital. And so introducing on this slide is Dr. James Otto, who is our lead CPET, which is our cardiopulmonary exercise testing service, and our prehabilitation service at UHS. So that's our local NHS trust. The CPET and prehab service is a really important part of our programme, as I mentioned, and it's a really unique aspect to our MSc at Southampton that isn't offered in any other UK-based courses currently. So the fact that we have a fully funded NHS CPET and prehab service is quite rare across the UK at the moment. It's an area that is growing, and we hope to see that opportunity will sort of happen across more NHS trusts. And that's obviously where there's a huge growing demand in terms of workforce in this area. So the fact that we already have an embedded service within our local trust, and that we're embedding this within our programme so that our students will have opportunity to work alongside this team and get experience of actually operating within a true clinical service, is a real strength to our programme that we're very, very proud of. So James leads on that CPET and prehabilitation service. He's also an accredited clinical exercise physiologist with the AHCS, and he's involved actively in research, but also that frontline clinical service. So he's working with us to embed this into the education delivery. And working alongside James, we have Dr. Gurinder Rayat, who is a senior CPET and prehab clinician at UHS. And so she's there with James operating their team and the services that they provide. Gurinder's also an accredited CEP with the AHCS, and again is heavily involved with them frontline clinical services. So all of those people will be people that you'll get to know very well and work with throughout this programme. Okay, so moving on, let's discuss clinical exercise physiology as a profession in the UK. So just a little bit of background really on this. So clinical exercise physiologists are a key part of UK healthcare science workforce. And so when I've been mentioning about the Academy of Healthcare Science, that's the sort of regulatory body for a number of those different healthcare science workforce. It falls under this sort of topic title of physiological sciences. The idea of a clinical exercise physiologist is that they work as part of a multidisciplinary team, so much like many other of the healthcare professions that you'll kind of come across, and working within various different settings, including prehabilitation and rehabilitation settings across different sectors and contexts. So very happy to kind of give some examples in the kind of Q&A session of where we may work, but I can generalise this to really working within NHS kind of healthcare provision, but also out in community settings, private practice, that type of thing. The other kind of body that's worth knowing about is Clinical Exercise Physiology UK, which gets shortened to CEP UK. And these are this organisation is basically considered to be our governing body. And so the quote here is how CEP UK define a clinical exercise physiologist as a workforce. So essentially university master's leveled qualified health professionals who specialise in the prescription and delivery of evidence-based exercise interventions to optimise the prevention, treatment and long-term management of acute, subacute, chronic and complex conditions. So it's quite a mouthful, it's quite a big quote there, but hopefully what that does is it gives you a bit of an insight into, I guess, the breadth of the profession and the number of different areas in which somebody, when qualified as a clinical exercise physiologist, that they could actually work in, certainly across the range and scope of clinical conditions, but also in terms of giving a bit of an insight into some of the sort of job roles that a CEP might actually contribute to. So as the profession and the workforce is kind of developing in the UK, what we've seen really is a real focus and development around the sort of professional recognition and also the governance in terms of managing the quality in which people are sort of operating as part of this workforce. So I mentioned CEP UK is our professional body. We consider them to be our governing body of the profession, and they basically set all of the programme level learning outcomes for all of the higher education institutions that are currently offering what we call an accredited pathway in our MSc Clinical Exercise Physiology. So they have essentially written the curriculum that anybody that's offering an accredited MSc in CEP are following. So all institutions that are offering this are following that same sort of programme level outcomes. Thereafter, the Academy of Healthcare Sciences that I've mentioned is the UK regulating body. So these two organisations offer something slightly different. So one is sort of setting up the kind of the programme structure and writing the curriculum at which they expect all university qualified CEPs to sort of work towards. And then the AHCS is the regulating body that ensures the professional standards. So in the UK, once somebody actually graduates from or completes an accredited MSc course, they can apply to the AHCS to become registered, to have their name added to the professional sort of statutory register. And that offers a level of sort of credibility to the person when they're then operating, both in terms of working in the NHS or working out in the community or in other kind of contexts and settings. So these two organisations are operating collectively to ensure the regulation and quality of education delivery across the UK. So with our programme at Southampton, we're working within those sorts of constraints because we want to ensure that anybody that undertakes our programme at Southampton, by the time they complete their masters, not only are they awarded an MSc from the University of Southampton, but they also have the option to be able to be added to the UK register, which opens doors and opportunities in terms of working in the NHS as part of this growing workforce. So we're in the process of validating our MSc curriculum at the moment with the AHCS, and that will ensure that those necessary minimum requirements will have met the requirements for registration upon completion. So that is a work in progress. In terms of clinical exercise physiology, sort of globally as a profession, a number of different countries already sort of operate in this space. So there might be termed things slightly differently, but essentially there are other kind of organisations that offer this level of qualification. So ESSA in Australia, for example, are the organisation that accredits their clinical exercise physiologists. So the scope of practice is sort of familiar to other countries. The scope of practice for a CEP is broad. So as an example, our curriculum has to cover some of or majority of major kind of conditions that fall within each of these different topic areas. So cancer, cardiovascular, frailty, renal, mental health, metabolic, musculoskeletal, neurological and respiratory. So the curriculum itself covers a real broad range of kind of chronic conditions, which really gives you an opportunity to kind of get into the theory, but also then when we think about our practice placements, the opportunity with our services to be able to explore and have opportunity to work with patients from these sort of differing clinical conditions, and acknowledging the fact that a number of patients these days actually present with multimorbidity. So not only teaching you about these individual conditions, but how they interact, and all sorts of things around medications and drug interactions and those sorts of things. So we go into lots of detail around the major conditions that you're likely to encounter. As I mentioned, CEPs work within multiple contexts. So I've mentioned kind of the NHS from a UK perspective, but just, in the sense of sort of healthcare provision. Private practice. So a number of people are interested actually in working as a clinical exercise physiologist with the idea of setting up a private practice. And it's definitely a profession that can offer those sorts of opportunities. And then a number of community settings. And you're likely to experience kind of operating within community settings as part and parcel of the placements associated with this course. So we work with a lot of community providers, local gyms and that sort of thing, that offer services to support patients who are out in the community. So no longer in hospital or discharged after something, or been living out in the community with a long-term condition, and how a CEP can have a really essential role in the sort of treatment and management and that kind of longer term adherence and management of a chronic condition. Evidence-based practice is an essential skill for a clinical exercise physiologist. And I think Gareth mentioned at the beginning, we are a Russell Group institution, which means that we are heavily focused on research. And as a result of that, we're heavily focused on research-led teaching. So all of the staff that I talked to you about earlier that are delivering into this as our core program team, we are all research active. And so, not only our research, but research in sort of general is very much embedded throughout the actual curriculum that we're delivering, meaning that you're getting the most up-to-date current clinical information being embedded within what we're actually teaching you. I should also say further to the program team, the people that I've given you an introduction to there are just the core people who are actually sort of developing and involved in the kind of day-to-day delivery of this program. But we have a much wider pool of individuals that support the delivery of this program. And as I mentioned, lots of other clinicians and various other healthcare professionals that will be coming in and delivering their sort of expertise and their clinical knowledge and clinical cases that they bring with them to support your understanding and your knowledge building in this steps. So on that basis, we are the forefront of healthcare delivery. And so Sandy, when she talked about the CPET and the prehabilitation service, as mentioned, we're only one of very few places in the UK that currently offer this as a fully funded service. That means the NHS pays for it. It started off initially from research specifically linked to cancer, but the outcomes were so brilliant in the sense of cost effectiveness and efficiency and effectiveness for patient outcomes that it has been rolled out to anybody from any clinical condition undergoing major elective surgery, which is a real testament and insight into the fantastic kind of research work that was undertaken by Sandy and others here at Southampton to support the rollout of that. What is particularly important is that just recently, last month, I think February, the National Cancer Plan for England, which is aligned with government strategy on supporting particularly cancer care within the next 10 years, has named prehabilitation as one of the most important factors that we need to sort of focus and develop here within the UK. And so prehabilitation has been mandated now for all NHS trusts, which basically means that NHS trusts across the UK need to incorporate these sorts of services into standard care for patients undergoing cancer treatment. What that means is that there is a really big drive for workforce development. And so it shows that we are really at this forefront of healthcare delivery in that people who will gain an MSc as a clinical exercise physiologist they are the workforce for driving these sorts of services in prehabilitation. So there's a definite growing need for qualified individuals to be able to support these healthcare delivery services. So taking that point on prehabilitation and focusing specifically on cancer, because prehabilitation can be applied across a number of clinical conditions. But I think it's really important to kind of demonstrate our USP at Southampton really does centre a lot on our kind of oncology side. So the clinical need with regards to this prehabilitation is that we know that cancer treatments often reduce physical fitness and resilience in patients, can increase surgical complications, length of stay in hospital, and results in poorer recovery. We know, though, through a lot of the work that Sandy and colleagues here at Southampton, as well as others, have shown, is that prehabilitation programmes can actually reduce complications, shorten hospital lengths of stays, and lower healthcare costs, which ultimately improves patient outcomes in the longer term. And I'm sure Sandy will be pleased to talk a little bit more about this if we have time at the end. But Sandy led some really large trials, WestFit and SafeFit as a couple of examples. These were large-scale clinical trials that demonstrated the effectiveness of the delivery of exercise interventions using community gyms and digital platforms. Some really interesting research that ultimately has led to, as I said, this fully funded service being provided here at Southampton. And this is what we are embedding as part of our education delivery within this MSc. So it supports priorities. I mentioned there the National Cancer Plan, but also the NHS long-term plan and government priorities around prevention, personalised care, and improved recovery after cancer treatment. In terms of the role of the exercise physiologist, so I mentioned James Otto and Gorinda Ray earlier. Those CPAT and prehabilitation teams, they essentially undergo, or patients within those services undergo physiological assessment, and then they interpret that data, they prescribe personalised structured exercise interventions, and that helps to restore people's fitness, quality of life, and enhance their sort of recovery from surgery and treatment. So I've kind of mentioned there that it is a growing workforce, and our response really is the development of this very much fit for purpose MSc to support that. Okay, so our programme structure looks a little bit like this, and I'm very happy to kind of go into a little more detail towards the end if you have any questions about any of these individual modules. But it's a 12-month programme, so we commence the programme midway through September. We've got 5 core modules that sit as part of the kind of the core delivery. 3 modules will be delivered in semester 1, and then 2 of the core modules will be delivered in semester 2. So we start with advanced pathophysiology and therapeutic intervention. So this gives you a background into the pathophysiology of many of those clinical conditions that form part of that scope of practice. So all of those topics that I mentioned earlier will go into detail around some of the kind of major and most often encountered kind of clinical conditions within each of those themes. Clinical exercise testing interpretation, you get to be really hands-on. So in our state-of-the-art labs, you'll be learning how to undertake different assessment methods with different populations and how to appropriately interpret that data so that you can then go on to think about how to develop exercise interventions from that. We're also interested in the whole person. So, you know, it's not just about data and you know, what people can functionally do and not do. It's also about understanding what makes the person tick. What are the barriers and facilitators for enabling them to be able to take part in exercise to improve their outcomes? What are the things that really drive, you know, their ability to engage and, more importantly, to adhere to exercise and physical activity behaviours thereafter. In semester 2, we take everything that we've learned in semester 1 and we start to pull it all together to be able to learn how to devise, you know, appropriate individualized exercise and physical activity intervention. So how do we pull all of that information together to be able to appropriately design these sorts of interventions? And it specifically has evidence-based in the title because, as already mentioned, research and evidence-based is an essential component of our programme. So it's really drawing from current clinical knowledge to really embed the most appropriate intervention design to be able to be used with patient populations. And then after that, we look at, well, how do we take all of that knowledge and that understanding of what's going to be a brilliantly designed intervention, and how do we physically deliver that with a patient? So that's more around, the actual, some of it is kind of soft skills. How do we work with a person face to face? How do we approach actually giving instruction? And also, how do we demonstrate those sorts of activities that we want people to do? And importantly, we also have evaluation, because we will never know how effective these interventions are unless we actually have some kind of evaluation. So that may be at the personal level. How do we evaluate how successful this intervention is being with an individual, and how do we progress and regress in terms of what we're asking them to do, but also on a broader scale. So, how do we evaluate things like our service delivery of our prehabilitation service, and how do we know that that's being effective across a wider population of people, and how do we feed that back into the healthcare system to ensure that there's sustainability in those sorts of things. So yeah, it's kind of from the small scale to the large scale, looking at evaluation in that sense. We then have this other kind of module, which doesn't sort of fit quite in the same way as these other ones, known as our practice placement portfolio. And our practice placement portfolio is really a collection of component assessments that relates to your evidence-based clinical practice. So we'll ask you to go out on 4 clinical placements across the year. The first is going to be an observation placement, so really just getting a bit of a feel for how multidisciplinary teams work within the healthcare setting in the UK. In semester 2, you'll have opportunity to go and work with our CPET and prehabilitation team. So your placement, you'll be embedded within that team, and so you'll be having hands-on, face-to-face kind of opportunity to work with clinical patients as they're moving through that service. In our summer term, you'll then go out on your 2 longer back-to-back clinical placements. These could be in a number of different areas, but it's highly likely that you will get a good amount of sort of community-based sort of practice placement in that sense. So, and I'll show you where some of our service providers are that you may be posted. So as part of those clinical placements, we ask you to be able to reflect on your learning and be able to feed forward those learning into the next subsequent placement. So our practice placement portfolio is an area really where you can bring those reflections together. And so that will form part of the assessment process of how you've managed to sort of learn and grow through those clinical placements over the 12 months. There's also a research project, and so that starts on day 1 in terms of you'll be allocated a research project supervisor. And the discussion will begin, from then in terms of what do you think you might want to do. So it could be a small empirical research, it could be an audit or a service evaluation. It's something that you can have a discussion with your project supervisor to sort of support you leading that project across the 12 months. That also forms part of the assessment of that practice placement portfolio. And then finally, it's kind of a place where we can also house some of the core requirements of that registration component that I talked about earlier with the AHCS. So there's a number of clinical competencies that everybody will need to tick off, and your supervisor will support you in ensuring that you're ticking off all of these particular clinical competencies, both throughout your learning in the sort of the theory sense when you're with us on campus, but also when you're out in your clinical practice placements as well. And then finally, placement hours sign off, because there are a minimum number of hours that you need to complete. On that note, though, you shouldn't have any difficulty in achieving it, because for the standard that's required for the registration with the AHCS, students have to undertake a minimum of 250 practice-based learning hours, of which 140 of those need to be within a clinical setting. Now, within our programme, we've planned for students to undertake around 300 clinical placement hours, so more than double what the minimum requirement is. And again, that is by design, because we recognise that actually for you to be the most effective kind of workforce and be, you know, as qualified, trained, ready to go as possible, it's those clinical placement hours, those hands-on hours where you're working with patients that are going to be most beneficial for your learning and for your future practice. So we've really embedded that, because we really see the importance of giving you those opportunities. We also have that practice-based learning embedded within our teaching. And so some of the examples where you get that hands-on sort of opportunity to learn within the programme, so not out on placement, but within your actual talk programme, are opportunities, for example, developing healthy conversation skills and your behaviour change techniques, where we actually use paid simulation actors to come in and you get to engage with those people in this kind of role play capacity to practice your sort of ability to interact. Real patient interaction. So we work with real patients who come in and support our delivery, so that you get to speak with them and find out how, you know, their experience of their condition. Lots of lab-based assessments. So our state-of-the-art research lab in our clinical research facility at UHS. So that is our clinical lab at the hospital. And we also have our exercise delivery module that will take place in different locations, but also within our state-of-the-art Jubilee Sports Centre. So that's our main sports centre on campus. So lots of different opportunities, not exhaustive. I'll gloss over this one a little bit because I've spoken a bit about it, but our prehabilitation and CPET service at UHS, there are links here which you will be able to find out a little bit more information if you wanted to after this, which talks to you about exactly how those services take, you know, have a role within the NHS service provision. And it will talk to you a little bit about the Fit for Surgery school there as well, which, as was mentioned in Sandy's kind of profile, she's lead for that particular component. And it's essentially a kind of a service provision that's available to anyone who's having surgery at UHS. Where there's a multidisciplinary team of individuals that work to support patient outcomes in themselves. So based upon 15 plus years of Southampton research, so there's also an awful lot of research that you can kind of go to and read up on if you're interested in this area. So just briefly, this map just shows you where some of our service providers are. So these are sort of possible locations where you could be sent as part of your clinical placement hours. So you can see there that actually this is a really broad kind of geographical area that sort of far exceeds just the local Southampton region. I will say that there is not desire, what's the word? There is, we are intentionally going to try and keep you as close within the city centre and within the sort of the area close to the university as possible, because just to try and limit really the kind of the on cost of necessary transport and travel to the different locations. But there's flexibility. So if anybody has a particular place that they would like to go and spend time in their practice placement, that we are able to sort of look at that and potentially offer offer and support you to go and have a placement in a particular area that might not be one of our kind of providers here. So that's something that we can discuss on a case-by-case basis. So I just want to finish off. I know I could come across as a little bit biased, but why Southampton? Well, we're a top 100 global university. We're a founding member of the Russell Group, and over 96% of our research is assessed as world leading and internationally excellent. So we're ranked third in the UK in the latest research exercise framework, and we're very proud in health sciences in particular that a number of our professions are ranked very, very highly across the UK. So our physiotherapy programme, for example, has been #1 in the UK for several years, and our OT programme is ranked as number 3. And as part of this programme in clinical exercise physiology, you have opportunity to engage with other staff, other lecturers, other these other professions across the university. So some really fantastic opportunities there. In terms of our city and campus, well, our main campus is on Highfield, but obviously we also have a great crossover with our hospital campus at UHS, and they're within easy reach of each other with regular bus services, but it doesn't take too long to walk, to be honest. We have brilliant green space. I love our campus for the fact of the green space that it offers, and a couple of these pictures on here have been taken on the Highfield campus. The one in the top right is our secret garden. I think they call it Valley Garden, but a lovely little spot, very quiet spot in the corner of campus where you can walk to. Very close proximity to the coast, and also great for easy travel to explore other parts of the UK. So only about 110 minutes on a train from London. So not too far at all. And I'm going to stop there because I've talked an awful lot. So yeah,
Danielle, thank you. Thank you. Brilliant session. Brilliant questions as well that have come in. If we could just leave it on that slide there, please, Danielle, that would be great. So thank you for everyone watching as well. You know, we've had quite a solid amount of students watching here. Most importantly, we've had a lot of engagement as well, which has been fantastic. Now, Danielle, just following on from what you've kind of spoken about, and I think it's important to talk about what a great place it is to live in Southampton. I think for those international students watching who don't understand the geographical location of Southampton, you're about what, an hour and a half away from London, Danielle, would you say? Hour and a half, 2 hours?
I mean, I looked at it, I looked it up to put it on that slide, and it says fast train is about 110 minutes from Southampton.
Yeah,
to London,
so there you go. You're talking about an hour and a half, but even if you wanted to get on a coach, which is very affordable, but it's a great part of the world to live in. There has been a question around where we would live. Now, I know you've touched upon that you know, they'll try and locate you in a place where it's easy to travel and get to. But what does a student do about accommodation up front? Because that's a big factor, isn't it, in terms of where they want to move to?
Absolutely, yeah. So I mean, the university offers accommodation. So we are a university that has our own sort of blocks of accommodation, our own sort of university accommodation dotted around the campus. So I'm afraid off the top of my head, I don't know the ins and outs of it, but I would be able to get further information and be able to signpost to certainly to our accommodation team at the university. But yeah, I know not every institution offers that, and we at Southampton do have that available.
Excellent. And for those watching as well, the staff that we've got on the webinar today are very much academic led. They will know their stuff when it comes to obviously IELTS, admissions types questions and accommodation and all these things. But please, we'll reach out to you at a later point with an email address that you can reach out to. Let's try and keep this as academic as possible. Danielle, one of the questions we've had was, are there any opportunities to engage with research teams? Could MSc students contribute to ongoing research projects within exercise, physiology or rehab research groups during the program? I think I know the answer to that, but do you want to elaborate a little bit further?
Yeah, well, I'm trying not to wave my hands around in excitement. Absolutely, yes. So as I mentioned, all of us on that core program team, we're all very much research active. We have our own kind of research areas. A number of us collaborate with each other and outside, both across the university and externally. We've got some great research teams and some great research that's ongoing, and we love it when students want to get involved in those projects. So yeah, absolutely. The caveat is obviously that the MSc is going to be quite fast paced in terms of the requirements and those sorts of things. But if a student has capability and time to support something else, then we thoroughly encourage that.
Sure. And the next question is, during the placements in the second semester, summer term, do students actively perform and interpret tests, or is it all observational?
No, so the only observational placement is the one that will be in semester 1, and that's very much just a kind of an introduction, a bit about sort of soft skills, those transferable skills. From the second clinical placement onwards, it's hands-on. So when students go into our CPET and prehab service, the expectation is that they will be working alongside the clinicians within that team to actively deliver those services. So it'll be done in a supportive way. So they'll start off doing certain assessments, and then with confidence they'll build. But by the time we sort of send you out on placement 3 and 4, the idea is that you have all of those skills and practical kind of knowledge and ability to be able to go out and fully support the service that's being provided.
Excellent. And I'm conscious Sandy's in the background and George also. If you want to answer any questions, please feel free to come on or guide them towards them, Danielle. A lot of questions are coming around. I'm studying nursing, I'm doing other health related programs. Typically, what would you expect a student to be studying before they come into this program? Because that, for a lot of people, it will be, well, I'm not really studying physiology. Is that relevant for me? What would you expect that to look like?
Yeah, so actually, I think one of the great things about clinical exercise physiology is actually we bring people in from really varied backgrounds. So, the I forget the exact kind of wording for it, but from our governing body, it's really anybody with a background in any kind of health profession. So it could be that it is sport and exercise, it could be that it's nursing, it could be that it's physiotherapy, it could be literally anything, as long as there is some kind of health related field as a background. So the expectation, as I said, is that we kind of hit the ground running. So certainly a background in some kind of core anatomy and physiology is the crux of it, but everything related to the specific role of a CEP is taught to you within this program.
And this is a great question. And I think it's quite a loaded one as well, which would be difficult to answer. But once they've done the program, they've done the course, they've they have kind of done their time. Do students tend to stay in the region, in the country? Do they go back to their respective countries? What would you expect that to look like typically?
Yeah, so I mean, obviously this is a brand new program, so I
Yeah.
don't have graduates to be able to kind of say what happens with us in Southampton. Across other programs, I think we see a bit of a mixed bag in terms of where people tend to go. I do know that a lot of international students are quite keen to come and develop skill sets that they can return to their home countries and be able to then sort of offer those sorts of services, which I think is fantastic, because I think it really broadens opportunities for people globally. In terms of sort of staying and workforce in the UK, the only thing I can really say is the fact that we have this drive, the fact that there is going to be an increased need for this particular workforce in the UK. I can only see that as sort of beneficial in the sense of opening opportunities for people in those sorts of roles in the UK.
Yeah, and I get it's a hard question, but so much of this is hypothetical because obviously it's new kind of for everyone, isn't it? But you are one of a very fair few offering this kind of program, which is really great to see. Career service post graduation, we've t touched upon it there. What can the students expect from the university? Is there a hand-holding exercise to help them get into recruitment, or is it a case of you're done? See ya.
I
I
mean,
suspect it's the first rather than the second, but
I was going to say
let's talk about that.
I would hate it if it was the latter. Absolutely. But it's, again, it's the first time that we're offering this program, very similar to a number of HDIs in this field, because, if I didn't make it clear earlier, the development of our governing body of CEP UK, that's only happened in the last few years. The development of the MSc curriculum and that accreditation pathway has only been around for the last 2 years. So there's only a handful of institutions who already offer this accredited program. There's several more of us that are coming online with these programs. And so what we're seeing is a real development of the profession within the UK at the moment, which is really great in the sense that it's exciting and we're seeing how that's going to develop. But it does also give a few sort of unanswered kind of questions, because the NHS is evolving their services at the same time that we're evolving our education services. So things like, for example, within the NHS, they are looking at developing more consistent job descriptions around the role of a clinical exercise physiologist. I mentioned about the fact that prehabilitation is becoming a mandated sort of service provision. And so as we start to see those those services coming online, we'll start to see the adverts coming out more for the people to be able to run them, which is our clinical exercise physiologist. So I don't have all the answers. The only thing that I can provide assurance for is that us as a program team are incredibly supportive, and we will be there to kind of support people on their kind of onward journeys.
Okay, the question for me, and I know we've kind of covered it a little bit already. Why do you think there has been such a firm focus on clinical exercise? Do you think it's, the aforementioned tighter job descriptions? Do you think there's a bigger reason for it post-pandemic, or is it just one of those things that has always been spoken about and just never really put into practice?
Yeah, so it's a really interesting one because myself and others have essentially been working in this role for the last 20
Yeah.
years. So there's always been a demand for it. What's been new in the last few years is the sort of the structure and formation and regulation that's come to the profession. So, and that's happened with the advent of Clinical Exercise Physiology UK, and then the actual relationship with the AHCS, where they've taken it on board and said, we're going to provide this professional regulation that allows you to become registered. And the key thing about that is that means we are professionals that are held to account over quality and service provision, and the sort of the practice in which we operate. And that's brilliant because that is giving us the regulation that allows us to operate just like all other health professionals in the UK. So I think it's developing alongside that sort of administrative side of it, really.
Yeah. Here's a great question. As a student, what can be done to start building a real clinical competence?
Oh yeah, no, that is a great question.
Yeah.
So so I'll sort of provide the assurance first of all that all of the clinical competencies that kind of need to be met by the end of the course will be covered within the course. So there's no obligation for anybody to come with, certain skill sets per se. It'll all be kind of taught to you. But if you have any interest whatsoever, then any kind of opportunity to work alongside any sort of health professional, sort of personal trainers in the gym where there's experience of kind of working with patients to devise interventions, to deliver exercise, that all counts, it all contributes, it all gives skills. Anybody working, as I said, in healthcare provision where you're actually working with patient groups, as a physiotherapist or within surgery or anything like that, gives opportunity for understanding around compassionate care and those sort of soft skills of being able to communicate effectively and those sorts of things. So the real sort of assessment, functional assessments may be more challenging to get experience unless you have opportunity to work within either a research or a practical lab where people are already offering these things. So that might be around muscle testing or something we refer to, well, when we talk about CPET, it's VO2 max testing. So you need kind of specialist equipment to be able to do those sorts of things. But if you have opportunity, cardiac stress testing, all of those sorts of things are some of the assessments and interpretation that would also feed into those clinical competencies.
You're using buzzwords. I've got a
I
family
am
member that
using
works
lots
in
of
this,
that.
and quite often I hear the words like that. I'm like, what do you mean? But actually, it's all starting to click into gear, which is great. One of the questions is it possible to learn virtually? I'm guessing this is very hands-on, therefore, you need to be in the city, in the region, in the hospital to do this. Let's talk about the learning. How do you expect the learning and education to come across to a student? Because obviously this is new for you. What can a student expect a classroom to be like when they're sitting down with you and talking to you?
Yeah, great. So yeah, really good question. We actually use a really varied learning kind of style isn't quite the word, but opportunities for students. And again, it's by design, but it kind of meets a couple of different needs. So in a sense, it's a way to explore different learning styles from different students. So the opportunity to sit down in a more formal lecture type of environment, through to more hands-on seminar discursive style that we can discuss case studies and talk about it with a lot of peer-led interaction, learning, and sort of formative opportunities for formative assessment and getting feedback. Through to, as I mentioned, some of the kind of assessment methods, we've just got to roll our sleeves up and get hands dirty. So we need to get in the lab, and we need to you know, put your gym shorts on and get on the exercise bike and get kitted up with all the equipment, and so lots of hands-on experience for students to actually run those assessments and learn how to lead those assessments, through to then, as we mentioned, the practice placements where you're going out into those environments and working with them. So theoretical through to practical, lots of different opportunities.
Sounds really exciting. Okay, just to wrap up then, talk to me about the intake date. So September 26 will
Yes.
presumably be the first intake date. Will there then be January intake dates, or will it be September and then next September following that?
Exactly that. Yeah. So it's a 12-month course, and we're just doing the one intake date. So
Yeah.
I think our welcome week starts on the 14th of September, and it's essentially nearly, I think it might even be a week over 12 months for the full program to run. So yeah.
Presumably you need to, if you're a student interest, I think I mentioned to you when you've had quite a busy morning with the amount of interviews you've had to do, which is great.
Yeah.
Students need to obviously get applying now, really get their backsides in gear and make sure that this is something that they want to do to really start inquiring now.
Absolutely, yeah. So the earlier the better. So we've got applicants coming through. I would also advise, it does go through our kind of central admissions team before the applications come
Yeah.
to myself and the team. So the best thing that people can do is to try to make sure their application is fully formed in terms of providing all of the additional information. So if transcripts and all of those sorts of things are ready to go with the admission, it just makes that process a lot smoother. But yeah, we're seeing applications coming in, and we're reviewing and interviewing now. So yeah, if anyone's interested,
Great.
then
Well, I'm sure there'll be plenty interested. I think it's been a great webinar session. Thank you for your time. To Sandy in the background also as well, a massive thank you. I know we've not heard much from you, but it was great to meet you. Great to put names to a face, and also George in the background also, who's helping coordinate and answer questions also. But Danielle, thank you for your time. To all of you that are watching, have any questions or anything whatsoever, please head over to their website. I'm sure Danielle, Sandy, and the team would be more than happy to communicate and talk to you about any concerns that you might have, about any questions that you might have about the program over the next 12 months, starting in September, and so on from there. So please just communicate. But for now, thank you. Take care. Have a good evening. Bye bye.